right, welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Kyle Gernhofer, founder of DenScore. Dr. Gernhofer practiced dentistry for over 15 years before launching DenScore, which is a platform helping patients make smarter decisions about their dental care. From navigation tools and insurance guidance to building transparency in the industry, DenScore is reshaping how people find and trust dental care by helping them find the best dentists and specialists. So today, I'd love to talk about your journey from Navy dentist to tech founder, leading innovative approach to patient navigation and what the future of dental access and insurance could look like. So thanks for coming on, Kyle.
Yeah, Nick, this is awesome. Thank you so much. Really appreciate the opportunity to be here. So that was a great intro, by the way. I'm originally from Traverse City, Michigan. Went to dental school at University of Michigan, then made my way out to California. And like you said, started out as a Navy dentist, did that for 4 years. Then I had a private practice in San Diego for 10 years after that. And then started DenScore in 2020, really with the goal of just helping people navigate dental care, really making smarter decisions about their dental care, whether that be choosing the right dentist, to finding the insurance that's best for their needs, and even assisting them in making decisions about dental treatment and at-home care as well.
So, what moments in your private practice work led you to realize that there was a need for better navigation and education for patients?
Yeah, that's a great question. I met so many patients over the years that they came to our office and they had some sort of dental insurance plan that they thought was the right plan. And, it just had poor coverage in terms of the dental procedures that were covered, or the annual maximum, or co-insurance. And so dental insurance is so complicated, right? And so that was one of the big things that stuck out to me in private practice is there's like all of these dental insurance plans to choose from. And how do you really know which plan is right for you if you're not getting it from your employer? And then, met a lot of patients that, went to a dentist and they didn't have a good experience. Maybe they actually were not informed about certain treatment options. And in our private practice, we wanted to make sure that we educate our patients, gave them all of the options, the pros and the cons to each option. And I think, unfortunately, in some cases, that's just not how it's done. And then, so how do you really know if you're making the right choice if you're not given all the options? And so when we created DenScore, it was really to provide that transparency around the care that you receive, but also insurance and which dentist or dental provider specialist is right for you.
Well, as a founder, because you founded DenScore, do you think there was, maybe things you gleaned while in the Navy or running your private practice that inspire you in your day-to-day running a tech company?
Yeah, absolutely. I think with any startup, we're like a lean team, lean and mean, right? This is a small team. And it's kind of one of those things where you get out of it what you put into it in terms of the work. And so for us, it's like, when you're in the Navy, when I was in the Navy and I was doing dentistry, I also had a very lean team. When I was on like a Navy ship for a couple of years, there's just like myself, a couple of young dental assistants that I trained, and like an admin on my staff. And it's kind of the same in the startup world. It's like, you have a small team, and you just really got to go for it. And you got to be flexible and nimble in terms of like what you're doing from an operations standpoint. And that's kind of the approach that we take with DenScore. Like everyone on our team has kind of bought into this, like the vision and the mission that we have in terms of really trying to help people make these decisions about their dental care. And so I think that's probably, when I think back to the time in the Navy and I was a dentist, is like, okay, well, what is this going to be like? Am I even going to remember some of the stuff that I'm doing? And I think it's kind of carried over well to what we're doing today.
So talking about the team, I think I'm curious as well, but I've had other guests on the podcast that are, at one point had a practice and then they jumped into the, tech market saying, like I understand everything that's going on. I've got a problem that I want to solve, but how do you end up building a team? Like, who do you look for? What qualities are you looking for? And who'd you end up finding that fit those roles?
Yeah, absolutely. When we started, we thought we were going to be doing something a little bit different. Actually, we went in with DenScore with the mindset that we were going to be more of like a data analytics company by working directly with insurance companies to analyze their claims data and to kind of help people find the right dental providers that way by kind of teaming up with the dental insurance plans. So one of the first things that I did was bring on a co-founder that was, a data scientist and had a lot of experience in that industry. And then, of course, we have like a lead developer, someone that does a lot of the development work for us. We have some that helps with like our SEO, kind of some of our general basic marketing needs. And then we work with contractors, for other projects when they come up, or certain things that we need to kind of optimize with the web application. Because I'll kind of take a step back here. Like what we really have with DenScore is we have like a web application. It's like a web app, kind of like not an app that you download from like, App Store or Google Play, but it's essentially like a website where people can go to, they can visit it, and they answer a series of questions and they get dental advice. And so building that, it was pretty somewhat of an arduous process, because we have over, I think it's about 55,000 question and answer combinations in this web app. So I mean,
Yeah.
we pretty much covered all. When if you have anything going on in your mouth, and so making sure we had the right developer on our team, and the graphic designers to kind of design the UX experience was very important. And then because we are a direct consumer company in some ways, where people find our web application, or they find our best dentist directories nationwide, or our best dental insurance directories, SEO is super important for us, right? Because we want people to find us when they're using popular keywords. So having someone solid on the team from a marketing standpoint is also huge.
What sort of keywords are people finding you for?
Yeah, so with our best dentist directories, we have these directories in over 2,500 cities nationwide. Best dentists in Chicago, best dentists in Seattle, and all the other small and mid-sized cities. A lot of the times people find these directories when they're just searching like best dentist Chicago, or best dentist Seattle, best dentist Cleveland, whatever the case may be. We're popping up in a lot of the AI search engines as well, which is exciting, ChatGPT and some of these other platforms. But when people also look for insurance, like best dental insurance in California for implants, or best dental insurance in Florida for high annual maximum, stuff like that, they will find our insurance directories. And then our free navigation tool, our web app, actually the URL is slightly different from our denscore.com. The URL for our web app is navigation.denscore.com. People will often find that if they're searching for like free dental advice, or, we've partnered with some of these healthcare organizations. Devoted Health is one of them. They're a Medicare Advantage plan, and they put our link all over their website so their members can find dentists and specialists by using our tool, and also just to get dental advice. So we kind of team up with organizations like Devoted Health, which is a Medicare Advantage plan, and other nonprofits and primary health, primary care organizations, that type of thing. But SEO, it's an interesting, it's kind of a black box in some ways. I'm sure, obviously, with what you do, you're probably familiar with that, right? And it's just like
Yeah.
trying to keep up with Google and all these different core algorithm updates that they're pushing out. That's something that we really try and stay on top of at the moment, because we have clients that are like DSOs and dentists that will advertise. They'll kind of put like featured listings in some of these directories that get a lot of traffic, and we want to make sure that, of course, we're getting a lot of eyes on these best dentist directories. So we're helping these dentists that we work with patient acquisition, and for a very affordable way.
Well, and getting a lot of eyes on there is one step, but at some point you really have to build trust as, industry leader in finance. So what steps have you done to build trust in the patient journey and with industry partners?
Yeah, for sure. We're very transparent about like the advice that we give. The advice that we give, number one, it's always evidence-based advice. When we're giving guidelines for whether it be if you think you have a toothache and you need a root canal, these are the things you need to know. Or if you need extraction, these are the things you need to know. When it comes to kind of dentists, which is a big part of what we do, and specialists and insurance plans, it's the same exact thing. For insurance plans, our team has actually gone through every single insurance plan offered in every single state, and we've come up with a list of the best insurance plans for every single state for multiple categories, such as implants, waiting periods, teeth whitening, annual maximums, like co-insurance. And so we stand behind all of the recommendations that we offer to our consumers. And when it comes to the dentist, we look at a lot of different factors. Patient experience is a big thing for us. So when we've actually rated dentists in these best dentist directories, we have a way of filtering through some of the online review platforms out there, whether it be Google reviews and Yelp and all the others, and looking for reviews that we feel are legitimate, and then discarding those reviews that we think are unfair or aren't really helpful for the patient experience. We look at things such as like what insurance plans dentists accept, right? Because we don't want to be sending our users to dental practice that aren't in network with any insurance plans, because a lot of people have insurance with their employer. We look at credentials of the dental providers. We look at hours and availability for the same reason we don't want to send someone to a dentist that's open 1 day a week. We want to, so that factors into play. And even something that we feel is very important, when people go to the dentist, we want them to have a very good experience when they're getting their teeth cleaned, for instance, right? In some dental offices, they made this zip through a cleaning in 10, 15 minutes because the dentist is doing the cleaning. Well, we actually look at dental offices that have hygienists on their team as a very important piece too. And so there's a lot of different things that we kind of like look at, we kind of combine those together, and that's how we come up with our scoring system for the dental providers.
And how many local directories do you have all together? Like how widespread is DenScore at this point?
Yeah, so we have, I think at the moment, we have a just shy of 2,500 cities covered nationwide where we have at least one like best dentist in city. Sometimes in a lot of those cities, I believe we have like best Delta dental dentists. And we're working with, some of the other insurance plans to try and figure out how we can kind of scale that to some of the other plans when people have, whether it be Aetna, Cigna, or some of these others through their employer. But we have, again, like almost every small, or I should say mid-sized and large city, and some of the small cities covered for just like best dentist near me, whether or not they're in network with insurance. At least it gives our users a tool to kind of like understand, like, okay, well, these are the best dentists that DenScore is recommending. I'm going to call them now, reach out to them and see if they're in network with my insurance plan.
Yeah. And that's a massive amount of data, right? I mean, how
Absolutely.
are you using are you using how are you using technology or new technology in order to manage that data, parse through it and make sure it's presented in a digestible manner?
Yeah, I wish I could speak to that knowledgeably. I should have my co-founder on the call. Like, she's the data guy that kind of handles all that. But yeah, we do have a way of course, kind of like getting information online and doing that in an automated way. And then we have checks and balances where our team is going through some of that information manually as well to make sure that like we're cross-checking what we pull online in regards to like the data from the dentists that we list in our directories. And like I said, the insurance directories, that was something that was not automated at all, completely manual, like where our team actually went through every single plan in every single state this year. And then we started to do it in 2024 because we just found that a lot of people were interested in that, like they were searching. Like one of the most popular keywords I think right now for insurance is like with dental implants insurance, and a lot of people are looking for insurance plans that cover dental implants, and also like no waiting periods. And I mean, insurance plans in dentistry, they're all over the board in terms of what their kind of plan design is. And that's what some people don't understand is everyone's like, oh well, insurance is terrible, it's a scam. And yeah, some plans out there aren't that great. Like if you're going to go buy a dental insurance plan for yourself or your family, I mean, there's some that have an annual maximum of like $500, and they make you pay like 50% like co-insurance, and it's like, wait a second, I'm probably spending more money in annual premiums and co-insurance than if I just paid out of pocket. And so it's one of those things where there are some insurance plans that are way better than others, and that's what we're really trying to help people find is those insurance plans that'll provide the most value for you and your family.
Yeah, then those are incredibly valuable insights. Can you talk about more insights you've gained having such a robust search platform with so much data?
Yeah, when it comes to insurance in particular, I'll give a shout out to one of the plans out there. One of them, Physicians Mutual, is one of them that we actually really do refer to a lot of people because they have, I believe this is an accurate statement, they have an unlimited annual maximum if you were to purchase that plan as an individual compared to some of the other plans out there, and very comparable, like co-insurance and deductible and waiting periods and all that other stuff. So that's one that a lot of people aren't aware of. Another one that we like is Mutual of Omaha has a very good plan in some states. Some of the bigger insurance plans that a lot of people know, I mean, in some states they're okay and others are not, but I think like some of the maybe the lesser well-known ones like Physicians Mutual of Omaha, they tend to be pretty good across the board. And so those depend upon the state that people live in when they're actually reaching out to us on the navigation tool. Those are two of them that we tend to recommend.
Sure. And I mean, is there a way you can influence or shape your involvement in dental insurance?
Yeah, it's one of those things where we don't have any official partnerships with any of these dental insurance plans right now. Like I said, the only one, well, I should say the only Medicare Advantage plan that actually we do have an official partnership with, where they have our online dental tool all over their website, is Devoted Health. Excuse me. As far as we know, there could be some other smaller insurance plans or Medicare Advantage plans that have our link out there, but we're not actually collecting data from any of the insurance plans. We do collect some of the data from the, well, I should say it's all anonymized data, but we do collect a lot of information from people that use our navigation tool, so we can try and use that data to improve the questions that we ask, and also the guidelines that we offer. So we do collect a lot of data that's been helpful to kind of really understand like how people are using our navigation tool, navigation.denscore.com. But we don't have any, we're not beholden to any insurance plan. All of our recommendations that we offer are strictly because we believe they are the best for that particular user and what their needs are when they're using our tool.
Well, what would you change in dental insurance? Like what would the dream, I mean, both for patient care and obviously it has to be a viable business model, but what would you change in dental insurance in order to make it really, successful?
Yeah, I mean it's a great question. I mean, dental insurance, like any insurance, it is very complicated. But I think what you have to do is if you're going to, number one, I think some insurance plans, they may only offer one or two options, and they really don't differ that much, between them in terms of what the plan design is. And there's a lot of people out there that have a lot of dental needs, whether they need like, a root canal and three crowns or whatever the case may be. And most of these insurance plans, most of them, not all of them, have an annual maximum of $2,000 at most. Every once in a while, you'll find one that's got, like I said, like an unlimited annual max with Physicians Mutual, or Mutual of Omaha has like a few tiers where I think 5,000 is their highest. And there's a few of these plans that have those high annual maximums, but that's one thing. I mean, if you're an insurance plan and you're offering an annual maximum of $750 or $1,000 or even $1,500, and then you're asking people to pay 50% of the cost of what that treatment is, I mean, that's just not doable. It's not sustainable for a lot of people, especially with the income that they have, and if they have a lot of dental needs. And so dental insurance is just not like, it's not like regular health insurance. A lot of people refer to it as a coupon, and I think in some ways it's kind of accurate depending upon the insurance plan you're talking about. But I think you have to increase the annual maximum, have an annual maximum that makes sense. You have to try and decrease the amount of money people pay out of pocket, and also have low waiting periods, because some people have to wait 6 months, or 12 months in some cases to get dental treatment they need. And they need it now, and they're paying the premiums, right? And so yeah, I think insurance plans can do a better job. I mean, they just have to, I think some people feel scammed, and also because some of these procedures that, let's say you do need a crown, and you wait the 6 months, you kind of go through the waiting period, you're ready to pay that 50% co-insurance, you only have a certain amount of money for annual max, and then it gets denied because some of these insurance plans have like very strict kind of policies in place in terms of what's approved and what's denied. But a lot of that isn't automated either. A lot of the times, it's a dentist that is actually deciding whether or not that crown should be approved or not, and they're looking at an X-ray, or they're looking at some clinical notes, and it is subjective to some degree. You put that same X-ray in front of like 10 dentists, you may get six that say one thing and four that say the other. And I think it needs to be more standardized in terms of, with insurance plans, in terms of approving and denying treatment. They need to have the plan design be more patient centric, because I think that's why a lot of people get kind of discouraged about insurance, because it doesn't really serve them. But kudos to the insurance plans, are doing a great job. Like I said, Physicians Mutual, Mutual of Omaha, there's a couple others that do a pretty good job. And then, even in some states, you get some of the bigger plans that everyone knows about, they're doing okay. But yeah, I think it's the plans that the employers offer to their employees. Those are the ones that really need to try and up their game, because, some people just feel, I think, like discouraged sometimes when it comes to insurance.
Yeah, they can be incredibly frustrating.
Mhm.
Well, so how would you innovate there? Like, I mean, is DenScore planning potentially on being involved in insurance to a higher capacity or?
Yeah, that's a great question. Actually, I haven't really released this yet to the public, but actually, I'm in the process with another with a co-founder of mine of launching another company. It's essentially an alternative dental insurance benefit for employers. where we're essentially going to be offering employers, it could either be a standalone or an alternative benefit to offer their employees. And so essentially it's kind of, I don't want to get into the weeds too much, but we plan on launching this here sometime next year. We're kind of building the product and collecting as much information from brokers, employers, employer coalitions, dentists, because essentially we're going to be giving employers something different than just your conventional, Delta Dental, Cigna, Aetna. It's going to be something that they can offer employees that gives employees more options and more flexibility. And I think it also will save the employee and the employer a lot of money when it comes to offering the benefit to them.
Okay. Yeah. And so what about the DenScore platform in general? I mean, aside from insurance, like do you have, especially with AI technology or being able to parse through data when you're getting massive amounts of data, like are there ways you're planning to leverage it to help the industry and to help, patients get better care?
Yeah, absolutely. What we're doing right now with our tool, we're looking at different ways of incorporating more AI into our navigation tool. We haven't done that yet, but that's something that is definitely on the horizon, where we're kind of analyzing all of the ways that people use our navigation tool, and that they answer a series of questions and we give them advice. And then, for us, when you look at AI, I think a big piece of it too is if you can kind of follow the patient's journey and figure out like what treatment they actually did receive, if they took your recommendation, if they received the treatment, what was the outcome. I think that's the challenging part, because for us, it's like we can continue to optimize the recommendations that we provide, but part of that is only possible if you're able to follow that patient's journey all the way down the line. And so that's what we're trying to work on right now, is how can we continue to kind of like follow up with the user that uses our free navigation tool, and figure out like, okay, that guideline, that recommendation actually did work very well, or they didn't actually listen to us and they did this instead. And so that's something that we're always trying to think about, like how do we continue to innovate and provide more, I guess, guidance that's more meaningful to people down the road. And so it's a lot of fun, because currently, as we kind of look at like some of the pathways that people take when they go through our, the navigation tool, it's really interesting to see like, okay, well, this demographic between the ages of 55 and 65 typically have issues with this. And then they make it all the way to, it's not like a gum issue, or maybe it's a tooth issue. And, this demographic that doesn't have dental insurance uses our tool for these reasons. And so, we try and collect, all this data and look for patterns in the data, again, just to continue to like improve the recommendations that we give.
Sure. So can you give me a good plug for DenScore? Like maybe walk me through who might need to use it, both from a patient or a patient perspective, but then also, I guess insurance perspective or industry partner, like, somebody that has a practice, how they can get involved?
Yeah, absolutely, Nick. So for the patient, the consumer, I mean, they can essentially just go to our free navigation tool. It's on our website. DenScore.com is our website. And then right below it, there's like a little button that says like, click here to get dental advice. And they click there, or they can go right to the URL. The URL is navigation.denscore.com. And when they land on that, they're given three choices. They say, do you need dental advice? Do you need help finding a dentist? Or do you need help finding insurance? And then they can click on one of those buttons, and then, based on what button they click, then they ask a series of questions. They submit that, and then we have care navigators, like real people. It's not like automated people or automated advice, right? Real humans that are actually answering each of those inquiries and responding to the user. And so that's how the patient benefits, and that's how, again, Medicare Advantage plans such as Devoted Health offer it to their members if they're looking for a dentist or if they want dental advice, and they literally click on that link. I think when it comes to like insurance plans, the plans that benefit most by partnering with us are the smaller ones, because those are the ones that don't have a proprietary provider network. In other words, let's say you get like a very small dental insurance plan or a small Medicare Advantage plan. Dentists aren't signing up for that plan. That small dental insurance plan or that small Medicare Advantage plan is borrowing like United Healthcare's like provider network, or Delta Dental or Cigna or Aetna. And so working with insurance plans, I think the plans that work best, or I should say that would provide the most value to their members by partnering with us, are the smaller ones that don't have their own provider networks. And then when it comes to the dentists, the providers, the specialists, a big thing of what we do is help them with patient acquisition. We have all these best dentist directories in 2,500 cities. We have dental insurance directories in every state for 6 different categories. When it comes to the best dentist directories, it's those dentists, it's those orthodontists, those oral surgeons, periodontists, pediatric dentists, and so on that are looking for an alternative way to acquire new patients. Let's say they're tired of spending thousands of dollars every month on Google ads or Yelp sponsored listings or any other marketing thing out there. We charge a very small monthly fee, and we allow them to create a featured listing in these directories in their city so they can get this more exposure and really show the consumer how they differentiate their practice from others in their town. And so currently work with dentist specialists, DSOs in that particular way, because they're like, oh my gosh, this DenScore company is getting traffic. They're charging us a fraction of what some of these other marketing platforms charge, and that's typically how we work with the providers.
Thanks, Kyle. Yeah, I mean, you're adding, a tremendous amount of value to the industry, making dentistry more transparent, patient focused, and I mean, they're navigating insurance, and these are all like very common, complicated issues that people have when trying to find care or to try to find patients to give care. So, yeah, and thanks for plugging what denscore.com. That's where you go to start the journey and finding better care.
That's right. Yeah, denscore.com is kind of just our homepage. I'd say for any consumer patient out there, the URL for our free dental tool is navigation.denscore.com. You can go directly to that if you like, or you can go to denscore.com. And if there's any dentists, providers out there that are looking for, again, alternative ways to acquire new patients, feel free to reach out to me. My email is kyle@denscore.com. And happy to have a conversation and share more about how we can help.
Amazing. Well, thanks for coming on the show, Kyle. I really appreciate it. It's been a blast.
Awesome. Nick, thanks, man. Really appreciate it.